From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Welcome back to Good Morning Arkansas. Have you ever heard that stress can take years off your life? Well, some research might actually be proving that point. So we're joined by Baptist Health Cardiologist Dr. Scott Davis here today, and you're here to actually talk about that topic.
Right. So, interesting study that was recently published in the British Medical Journal. A group of physicians in Sweden did a study looking at the role of stress, and not just, having a rough day at the office, but, beyond PTSD stress, stress anxiety disorders, the acute onset of any kind of stressor that would be diagnosed like by a psychiatrist. And even though we know stress plays a role, this is the first time that a true diagnosis of stress as it relates to your heart has ever been published. And so, interesting construction of the study. They looked at over 100,000 people compared to their siblings. Okay.
Oh, interesting.
And then they matched that, age-adjusted that to another 1 million people over about a 7-year period. And there was a significant, over 60% increase in the risk of developing cardiovascular disease within the first year, especially of a stress-related event. Not just, a hard day at the office or getting in an argument with your accountant, but a legitimate, near-death experience, loss of a spouse, that kind of significant stressor. And within the first year, you had a 7-fold increased risk in developing heart failure. We've known about this broken heart syndrome you may have read about in the papers or in the internet and the media, where a significant stressor can cause then a transient reduction in pump function. But this is a different study looking at a different dynamic of developing specifically heart failure within the first year. And then over the next 7 years, there's still about a 29% increase in developing some type of cardiovascular issue. So it begs the question, number one, we need to do more research into this. And number two, what do you do about it? Well, I think it's important then that we understand the union now of the heart system, the cardiovascular system, and then your overall psychiatric system as far as developing stressors that may be very impactful in your heart health, right? And that if you do suffer then from some kind of PTSD type of experience, some kind of, an acute a stressor like this, and then some symptoms persist like shortness of breath, chest pain, not only do you need to bring that to the attention of your primary doctor, maybe your psychiatrist, but also we need to engage a cardiologist in the same setting.
Yeah, that's so interesting. I don't think people necessarily think of heart health when you're thinking of PTSD, but really quickly, let's go over what stress disorders are for people at home that maybe don't know.
Right. So it's a broad spectrum of PTSD, post-traumatic stress disorder, acute stressors, and there's a whole battery of them that you can seek out attention with your psychiatrist to have those evaluated. Again, it's not just I got in an argument with my spouse, or somebody cut me off in traffic, and that kind of stress, or I'm having a bad day at the office. It's legitimate stress disorder. But the curious thing is that this is the first time that it's been formally evaluated as its impact on the cardiovascular system, and it's very interesting data.
So what does it tell you as a physician? What are the steps moving forward now that you have this research?
Well, look, we can't eliminate stress in our life. And so then it begs what do we do to help better manage it, right? And so that then goes beyond just this brief discussion, but doing healthy things and finding certain outlets and ways to relieve your stress. And it's usually in a healthy aerobic way is the thing from a cardiac standpoint we recommend. And it's the whole get off the couch concept that we talk about often in this setting. We like to see people exercise for at least 30 minutes a day, 5 days a week. Now, you don't have to go out and train for a marathon. Yeah. But it's amazing then, and it'll be interesting to see using this data to say, okay, now that we've identified a root issue, then what do we use this data to then recommend as far as here's some treatment strategies based on this. So this is new data. It's going to require more research, but it then will beg, identifying the problem and then the association of two issues that are psychiatric and stress related and cardiac related. Then we'll start to implement, okay, trying this exercise strategy, trying this, stress relief strategy, maybe may be more beneficial to you over the long haul.
And before we run out of time here, just if someone's watching this and they have a stress disorder, maybe they're experiencing some of these symptoms, what do you want them to know?
Well, at Baptist Health, we are a full-service providing facility, and so not only do we discuss and want to engage people about their overall cardiovascular health, but their overall health in general, and their mental health is an important piece of that too. So reach out, contact us at Baptist Health. We'll be more than happy to get you steered and plugged in with the right folks.
Perfect. Dr. Scott Davis for us, thank you so much. Like you said, if you think you might be experiencing some of these symptoms, reach out to Baptist Health. You guys, like you said, full service there. So
that's right.
Anything people might need.
Good to see you.
Yeah, good to see you. Thank
Thanks.
you so
Have a
much
great
for
week.
being here.